We need to help parents understand their own symptoms may have stemmed from childhood developmentally and don't have this genetic component that they believe they're passing on to their children. They said, oh, my child finds it hard to with language and writing, but I have that struggle too. Or my, depression runs in the family and anxiety runs in the family. Well, a lot of people have dysfunctional breathing, which would create a stress response and impact sleep quality and impact cognition and impact emotion regulation and all of these things. So parents are coming up against all these gaps in the medical profession because when they see their child needs adenoid tonsillectomies, they go to the ENT specialist to have them removed. And of course, it helps a little bit to open that up, but the child probably still has disordered breathing and sleep apnea. Because the ENT didn't think, well, should I check the child's nasal breathing? Should I check that they hold their tongue in the right position? We need to stop the mouth breathing that's creating a lot of inflammation, creating a lot of cognitive problems, emotional problems, and the ENT doesn't know. And then the child will have a speech impediment in some cases, and they go to a speech therapist, and unless that speech therapist knows about myofunctional therapy, that speech therapist university degree actually didn't cover the tongue's role in nasal breathing, anything about mouth breathing. They only concentrate on the tongue function for articulating, which is crazy. So they'll be working on getting this child to speak more clearly, not realizing that that child is mumbling their words because they're trying to breathe through their mouth and articulate, but their tongue has to stay low to keep the airflow. So the tongue's not making all of these sharp movements. It's sort of staying in the bottom and mumbling, and they don't know this. So you really need to inject myofunctional therapy into a speech pathology degree, a medical degree for an ENT, a general practitioner's degree, a dental degree. Many dentists don't realize that the tongue is creating a lot of malocclusion issues. The mouth breathing creates the issues. And so a parent goes to their general practitioner saying, my child's struggling, they've got various symptoms, and the GP doesn't know about breathing and sleep and doesn't look inside the oral cavity and assess what the tongue is doing and how the breathing is. And so we really want parents to understand from experts like yourself and going to a myofunctional therapist or an orthodontist who is well-versed in orthotropics and realizing this is the pathway to health. And there are signals on our face that give us clues. As you said, the double chin, that's not necessarily someone carrying extra weight. That's someone lacking bone in the face. There's a diminishment of bone. If the bones had grown to their full size, everything's held nicely and it's not going to droop. And if the child has the flat cheeks and the lips that hang open, or maybe the ears that pull slightly forward because these bones are falling in, or the eyes that have narrowed in, and the nose that's starting to pull back, and they look cute even when they're mouth breathing at age 2 or 3. But by the time they're 5 or 6 and you're starting to see the teeth don't have any gaps between them or maybe are overlapping, and the child's starting to get this elongated flattening of the face, there are markers that we can tell parents these are markers of a compromised airway, because anything diminished here is compromising the size of the nasal cavity and the oral cavity. A beautiful face is a marker of a big airway. It is, and no one's telling us this. We like a supermodel's big, broad cheekbones and big eyes on the face and broad dentition because they signify a fully grown maxilla, a well-placed mandible, and unobstructed airways. And it is really just that clear. And it's not just the beauty that we can take note of. It's that when the breathing is disrupted, it's going to create manifestations in children that can look like poor attention. It's that when the breathing is disrupted, it's going to create manifestations in children that can look like poor attention, poor schoolwork, behavioral issues, bedwetting, because tell me if I'm wrong, is it that a carbon dioxide buildup in the blood tells the body it weakens the muscles. It weakens muscles around the bladder, and then the bladder releases at night because that child's CO2 levels are too high. So these vital bodily functions are affected by our gas exchange of oxygen to CO2. And this is where breathing comes into just basic function of our body.